February is American Heart Month, and believe it or not, heart disease is the #1 killer of both men and women. So today we have Bon Secours cardiologist Dr. Andrew De Nazareth here to tell us more about heart disease, what it actually is, and answering some questions that we have surrounding the topic. Good to see you. Thank you so much for being here.
Thank you for being here.
Welcome back. Yeah. So let's start with definition for heart disease. A lot of people kind of lump a lot of these together, but what is it specifically?
So anything that affects the function or the structure of the heart in general is heart disease. So it's different segments to it, and I can elaborate on that.
Yes, please do.
Yeah, so anything that affects the plumbing or the blood supply to the heart, that's coronary heart disease. And it's the most general term for heart attacks and events like that. And the second part to it is arrhythmias, or anything that affects the electrical system to the heart. Or if it actually slows down and people need pacemakers. And then the third part to heart disease would be anything that causes the function of the heart to suffer, like congestive heart failure. And the fourth one would be structural, such as valvular heart disease or congenital heart disease, things that we're born with.
So there are lots of different subsections to heart disease.
But you're saying all of these combined, 80% of this can be
Most of it is preventable, yes. And if we stick to certain good regimens, like what the American College of Cardiology and the American Heart Association say, yes, we can follow a lot of preventable measures, just something as simple as eating right, staying active, not smoking. The big ones are watching your weight, watching your blood pressure, blood sugars, and cholesterol. So those are the seven simple life hacks that you can do.
And it's incredible to think about that. A lot of it's preventable based on lifestyle and choices that you make. So
that's right.
Definitely keep look at that blood pressure and all those kind of lifestyle issues as well. How do we know if we're having something that's heart related or something that's just like a normal anxiety, some other things, maybe stroke related? How do you differentiate those types of symptoms?
So if it's stroke related, of course, it's a more neurological issue where you either have a droop on one side of your face, or you have one side of your body not functioning well, or if you cannot feel something suddenly on one half of your body. When it's cardiac, it depends on which segment of the heart is being affected. Of course, the most common one that we know of is coronary heart disease and chest pain, or pressure or tightness in the center of your chest, sometimes going up to the neck or the arms or between the shoulder blades, when you exert yourself especially. And it settles down when you rest. Most of that is the start of coronary heart disease. The other symptoms to look for are, leg swelling if it's congestive heart failure, or shortness of breath, especially every time you try to lie down and we get better sitting up, or palpitations, racing heart rates, passing out if it's an arrhythmia or dangerous heart rhythms.
I feel like if I passed out once, I'd be like, let's go.
Oh yeah.
We're going to see Dr. Andrew, on speed dial. But some people, it may not be that drastic, but you're like, is this a big thing? Do I need to call my doctor? Do I just need to go to sleep? Maybe I had too much coffee. You can talk yourself away from anything almost.
Yes, it is important to listen to your body, and if you have some certain signals like the ones I was talking about, it's probably a good idea to at least get in touch with your primary. If it's bad chest pain not going away, we say call 911 or get to the ER as soon as possible.
Yeah, and you listed some lifestyle things that you can do. For some people, doing all those is a little overwhelming. Okay, so the #1, would you say, if you're working on it better, the smoking?
Smoking is definitely #1. It's preventable. It's not easy to give up. It's one of the most addictive substances out there in terms of nicotine. But there is help, and we as cardiologists can help with medicine. There's hypnosis. There's different ways to overcome it. And of course, there's no substitute for diet and exercise.
Right. But the thing is that once you start eating, even if it's just a little better than what you're doing now, then you'll start to make even better decisions. And then once you start moving more regularly, you're not going to want to eat as poorly as so it is. You just have to kind of get started.
Yeah, it's a cycle.
It is. It's important, and a lot of us have set some New Year resolutions. It's important to follow up on it. But one simple tip that I'd say, at least for diet, is if people can cut out the sweets or the bread, rice, and pasta after 6 p.m.
After 6 p.m.
So I say go ahead, breakfast and lunch, go ahead and eat what you want to, because your metabolism's still at a higher level and you can burn it off. But later in the evening, if you can cut it back to lean meats, veggies, and salads at night, and some fruit after that.
You heard it from the doctor here, guys. You can always
like
get in
that.
touch with him at bonsecours.com. Thank you so much. Great information
Great
for Heart
tips,
Month.
Doc.
Yes.
Very
You're
good.
welcome. Thank you for having me.
All right.